Hello, my name is Anthony Ford, and today I'm going to be presenting on hypertension awareness and why I think it's really important and important demographics that I think that you guys would appreciate, even if it's only just one major one. So, what is hypertension? So, hypertension is beautifully simple. It isn't a virus, it isn't some infectious disease, it isn't a traumatic injury. All it is just chronic high blood pressure. So, chronic just basically means long term, just long term high blood pressure. So, what qualifies as normal blood pressure is just 120 systolic blood pressure over, I believe, 60 uh, systolic blood pressure, and basically you measure it with millimeters of mercury. So 120 over 60 millimeters of mercury. Now, stage 1 hypertension is 132 over 88 millimeters of mercury, and then stage 2 is 140 over 90 millimeters of mercury. So, if all it is just high blood pressure, then what exactly why is it so important to be aware of it? Well, the key thing to understand is that it's a symptom that leads to horrible, horrible things that could happen. So, which one specifically? The three big ones that I figured out and looked up is a stroke, heart disease, and aneurysm. A stroke is essentially just when you have high blood pressure consistently that leads to an artery exploding. And now you have internal bleeding, and now certain areas of your brain just isn't receiving oxygen, and now you're undergoing necrosis. And necrosis basically just means tissue dying. This could be muscle tissue, it could be your brain, it could be pretty much anything in that same vein. Heart disease, basically it can be created with hypertension as a symptom if high blood pressure over the years thickens blood vessels and the muscle heart walls. So the cardiac muscles in your heart will enlarge and the walls will literally thicken, and that open area where it fills up with blood, so that way the cardiac muscles don't immediately die out because it consistently needs blood. It can't go a second without it, or else it will immediately start undergoing necrosis. It won't fill up with enough blood if the walls are too thick, which means the volume of blood that's supposed to fill in the heart simply isn't enough, and now you're developing heart disease. As for an aneurysm, if you have your high blood pressure consistently pressing through a weakened artery, sometimes it doesn't explode like a stroke. Sometimes it just forces it to enlarge. And that enlargement will eventually cause internal bleeding as well. And that creates an aneurysm. And all these things are just from hypertension, including the picture to the right of us. Just blocked arteries, partial blocking, kidney failure, hemorrhagic stroke, which is what I was discussing earlier, just a stroke in general. All these things just from blood pressure as a mere symptom. And it gets worse if you're a woman, because out of all of out of all the statistics I looked through and the different graphs I've looked at, what was staggering the most is that women, as their blood pressure increases, their severity and a risk for a stroke just kept escalating higher and higher, consistently more than men. And which is even worse because hypertension is hereditary. So, a perfect example is me. My dad has a blood pressure. He just went to the doctor a couple of days ago. He has a blood pressure of 160 over 90. 160 over 90 millimeters of mercury. And I'm probably going to inherit that. I can feel it, that's for sure. My blood pressure is raising like every other checkup. So that's going to be fun. And it's even worse if you're pregnant and you're a woman, because hypertension definitely isn't going to help delivering the baby any easier. And also, if you have a daughter or a son, they're going to inherit that. And what would be horrible is if you had a stroke while being pregnant, while carrying a child. And already your body's undergoing a huge strain just to keep the kid, from developing as an embryo to a baby. And what's crazy about this is that, according to the CDC, women are generally slightly less aware that they have hypertension than men, when it's so much more of a greater risk for them. And it just boggles the mind. It just boggles me. It's very scary that people are willing to live out their lives with hypertension, and just as they get older, they're just going to have a higher and higher risk of having a stroke or heart disease or an aneurysm or worse. So, what can we do to prevent hypertension? Be aware of it in the first place. That is the big one. Go to the doctor for daily checkups. Make sure, do you have chronic hypertension? Are you aware of this? Is it something that's fixable? Do you need to be in an emergency right away? Just be aware of it. That prevents so many problems. Just be aware of it. But luckily, remember, it's just high blood pressure. It's so simple. Sometimes you just have too much cholesterol blocking up your arteries, and all you have to do is have a better diet. Sometimes you just need to simply exercise, take care of your body a little bit more, sleep some more. Having plenty of sleep helps your body repair itself, helps it maintain homeostasis in a better sense, and just de-stressing. All these things just lower your blood pressure. It's a very natural thing that you can stop. This isn't something where you need to get a vaccine. It isn't something you need to get a cure for. I suppose you could get prescriptions, but unless it's something extreme, really you should just be able to take normal, plain old tried and true advice of just taking care of yourself, and you can prevent getting a stroke. You can prevent heart disease, or at least for a lot longer. You can prevent having an aneurysm just by simply taking care of yourself. And that's the nice thing about being aware of hypertension. It's a fixable problem. And that concludes the presentation.